Welcome to the Soulful Surgeon Podcast with Dr. Lisa Hunsicker, a sanctuary for healthcare workers. In this space, we honor your stories, your struggles, and your triumphs. Here, you are more than your role. You are seen, heard, and celebrated. Join me as we explore conversations that nourish the heart, elevate the mind, and remind us why we chose the path of healing. This is your time. This is your place. This is the Soulful Surgeon Podcast. Hi, everyone. Welcome to the Soulful Surgeon Podcast. I'm your host, Dr. Lisa Hunsicker. This is the place where healthcare workers come to be seen and heard, and this is where we get to be human beings and stop being human machines. Today, I want to talk to you about the 7 remedies of being. And this, as you may have seen on our first episode, this is really what helped me get out of a really, really dark place. And so I'd like to spend some time going over each of these so that we can really begin to focus on all of these facets of who we are as human beings. As we go on throughout the podcast, each one of these podcasts is going to be based on one of these remedies of how we can make ourselves better. Now, the overview of this is there are 7 types of being that we really want to focus on. The first is our physical being. The second is our mental being. The third is our spiritual being. The fourth is our sense being and our intuition. The next really relates to how those are really about who we are. And we want to take those 4 beings and then we want to also be able to have relationships with people. And this is going to affect our relational being and our community being. And these really affect who we are interacting with and how we're showing up for those people. And then finally, the 7th being that I want to talk about is the intentional being. And that's really getting down, stripping away of all the things that we do and all the roles that we have and all of the titles that we have, and really look at why are we here? What's our purpose? What are we doing? And I really feel like our programming that we've had through all of our medical training, whether you may be a physician, you may not be, and you may be any of the other specialties, nurses, nurse practitioners, PAs, any of the ancillary staff, of course. So everyone, we've all been trained to deal with very difficult situations. And really one of the things that I really feel strongly is that, training is our superpower. And really we have been trained to become dehumanized because we're doing really difficult things. And we're basically getting to the point where we're dehumanized so that we can make all things as routine as possible. We want to disconnect from all people, all pains, all difficulties, and we just really become stuck on autopilot. And even to the extent in many cases, and I know this is the case for me as a surgeon, that all of our primal needs are erased as well. We don't eat, we don't drink, we don't go to the bathroom. And certainly I know for myself, I have several, cases a week that maybe these might be 5 to 8 hour surgeries. And so we don't come and go. And you have to be mindful. You have to eat before you go because you can't stop and eat during your case. You can't run to the bathroom. You can't be sick. And you just have to keep pushing through. So really all of this training has culminated in an exam at the end of your training to just stop all the things of being a human being so that we can show up for everyone in the most dire of situations. And the conflict that happens is that, the public demands for us to show up for their suffering in some fashion. And it might be something simple as I'm really stressed, doctor, or, I'm dealing with, the loss of a child. I'm dealing with, I'm having chest pain, and is it anxiety? Am I having a heart attack? Am I having a stroke? It could be patients showing up who aren't even conscious, who have been injured. Maybe they've been in a car accident. Maybe they've been shot. they're in critical situations, and so they're not even participating in their care. And the things that we have to show up for are very dire, but in many cases, very graphic, very hostile. We wouldn't do this out in public. Um, one of the things as a trauma surgeon, there are cases where we have to open people's chests up in the ER. So you're in the ER and we're opening a chest up and we have our hands on someone's heart. And that's not an everyday occurrence for most people. And you have to learn how to do that and separate from your own being, really. And so the thing is that we learn very early that we get a shield, and we put this shield up around our heart, except that over time in our training, that shield really evolves and it's multi shields and ultimately becomes a wall, and the wall is not coming down. And so we're not able to connect outside of these walls. There might be someone inside that maybe understands and we can communicate. But we're really not communicating with our patients. We're not communicating with our loved ones. We're not even communicating with ourselves, and we don't really understand what's happening. And so the problem is that when we show up in these ways, we are really acting in a way that is not it's not human to us. And so we are the servants to our patients, and we are denying our own needs for the patients. Now, the thing is, we have to do that. We have to do that in order to accomplish the goals of patient care. But we also have to be able to stop, put that shield down, and say, okay, now I'm Lisa. I'm the girl, Lisa, and I'm going to go home and I'm going to be the girl, and I'm no longer with the shield. And I have needs and I have to take care of these things. And I have a very busy schedule and I've got to work these things in because I can't go without being a human being for a significantly long time because it detracts from me and it harms me. And so what we end up having is we have this chronic self-abandonment, and we just can't do that long term. It's not sustainable. And the way healthcare is right now, we're in a crisis. And there is no way that we're going to be able to continue to do this. And one of the issues, really, we see our young colleagues coming in and they're saying, this really is not working for me. And so they either have to leave or succumb to this whole idea of loss of who you are. And so this is generational trauma that's been happening for generations and generations and generations in medicine. And the training that we receive as physicians, we're taught this is military style, right? Because surgery is based out of military medicine and war medicine. And then all of the other areas of medicine fall in different areas and different layers of it. And then anyone who has any contact with us, nurses, PAs, respiratory therapists, dietitians, nutritionists, everyone who is in contact with us, all of that bleeds into them. And this is the whole kind of pyramid of hierarchy. And we have this training that is now falling into so many areas of medicine. So now we have to really think about this in a new way with this generational trauma, and that we all are victims of a past training cycle that is no longer compatible with what we're doing now. And the problem is that we have been violated, and over the years we've become hardened, and then we become the violators, and then we pass that entire work ethic and self-sabotage and self-abandonment onto the next group of folks who are coming. And the problem is that we say, look, you're not good enough and you're not worthy, and you just can't keep up, and get out if you can't keep up with us. And this is what you have to do. And there really is no room in that paradigm for change, evolving, and saying, look, you as a human being, we need you here and we need the quality you so that you can give great care to your patients. And we need you long term, but that's not really happening. And so what we have to do is we have to change this gold standard that we have put out generation after generation after generation. And we need to stop this and we need to start a new narrative. And the narrative of healing ourselves, healing our patients. Because if we're not healed, then we're not doing our best. We're not showing up for our patients. But we also have to teach that to the next generation. And we have to hold ourselves to a very different standard to what we've been trained, which is going to feel awkward. And it's going to feel like we're not showing up and that we're abandoning patients. We are not abandoning patients. When we're on the airplane, what's the first thing they tell us? If there's loss of cabin pressure, please put on the mask. Put your mask on first before you help others. And the problem is that we're running around with loss of cabin pressure everywhere. And we're making sure everyone's got the mask on and we're holding our breath the whole time. And it's not sustainable and we're not doing it. We're not doing it well. So this whole idea of the 7 remedies of being, I want to really break this down because we have to unwind and talk about our training and say, okay, what is it? Who are we? And how are we going to make a difference each time? And each one of the specialties in medicine is really going to have different stresses. And certainly our colleagues who are in the emergency department, interventional radiology, and in surgery, I feel like these are going to be some of the highest stresses because everyone has stress except that the time is very, very compressed and it's a recognize a problem and solve a problem as soon as possible and as efficiently as possible and with as much care for the patient and care for the teams as possible. So we don't have much time to think about it. And so I feel like those autopilot tendencies that we're on, we've got to unwind those. And all of our colleagues who are in all the specialties, pathologists, radiology, OB-GYN, family medicine and internal medicine, all of the specialties. Everyone has all of this going on. The other thing is we have all of our clinics. And if you're not in the OR and you're not on the wards in the hospital, you're in the clinic. And those clinics are going quickly and the patients are still coming in very, very sick that they need to get to the hospital. And we also have to be able to do that. So we have to be able to show up. But we have to look at this and say, okay, how is this affecting me? And we have to begin to design these clinics and we cannot be run by insurance companies dictating you're only going to get paid $2 to see this patient, so you get 2 minutes with them. We have to come up with something different. And we have to design this whole landscape. And this is our choice to do this. And so this is how we're going to do it. So the first one is the physical being. And this is simple, right? Take care of yourself the way you take care of your own patients. And this is something that has been incredibly difficult, I think, for many of us, because we just go and we just go and we just go. And we have terrible schedules. We're in very early. We're out very late, unless you're on the night shift. And then you're even super late. And then you get out in the morning. And so people who are working all night are dealing with lack of sleep and a normal circadian rhythm. We're dealing with all of this sleep deprivation. We're dealing with all the things as we age, lack of sleep, menopause, hormones changing, fatigue, the effects of our diet, the effects of alcohol. And I think this is something that we really, really self-soothe in medicine quite a bit. And we really need to pay attention to this because, one, it doesn't work in the way that we're using it. And two, it really affects our sleep. And so long term, it's not going to be a good solution for us. It's one thing to have a glass of wine with dinner, but where we're consuming higher amounts of that and later in the evening, we are really impairing our sleep cycle, and that's a problem. Now, the 24-hour shifts. This is something that's very common in surgery and especially in trauma. Most of the specialties have really been mindful and have pulled back. And now we have hospitalists, and the hospitalists are shifting on and off. We still have to deal with the sleep issues of being up in a non-natural circadian rhythm, but at least that schedule is being applied to really all of our colleagues in that time frame. So they have that and they can go home, they can still get sleep. The problem is that when you're on a 24-hour shift and you are expected to be awake for 24 hours and there's no built-in protected time. And the thing I hear over and over again, because remember, I'm married to a trauma surgeon. I've done a trauma residency, or excuse me, I have done a surgery residency. And so the thing is, being up all night, you're not necessarily sleeping. Yes, occasionally you can get a nap here and there, but it's not good quality sleep because you're always, that tone of the pager will take you from relaxation and calm into running 100 miles an hour. And so the problem is that if you are on a trauma surgery call, you can be up operating all night, all night. And then you have the day after and you're trashed. And the problem is that as we age, this gets worse and worse and worse, and it's cumulative to our body, and we're not paying attention to that. Also, we have to go out and we have to go do all of our imaging. Women, we have to do our breast imaging. We need to have our hormones checked, men and women. These things are changing all the time, and we're seeing hormone effects changing and affecting people younger and younger. You have to go and you have to take time. You've got to take a day and go get all of these things checked. Men, you've got to check your PSAs. You have to keep up with the urologist if you're having urology symptoms. And the thing that we all are doing is we're putting Band-Aids on symptoms that we're not really addressing. I had a call from one of my anesthesiologists who called me and said, hey, I'm making the call that I never expected to make. And this really is, it's really hard. Lisa, I have breast cancer. So we had this conversation. And by the end of the conversation, when I asked her, when was your last mammogram? She basically told me, well, it was 8 years ago. And that's a problem. And I said, look, you're doing these cases with me all the time. You see what we're doing. Why aren't you doing that? And what she told me was, I'm just so busy. I just didn't have any time. So we have to make time for all of these things. Now, the next thing is our mental being. And I think this is critical because there is so much going on in medicine and we are dealing with so much fear, and no one really has addressed this. We're dealing with fear of doing the wrong thing for patients. We're dealing with fear of making a mistake, fear of harming people. But in addition to that, we're dealing with fear of being sued because everything we touch in medicine is glued to some sort of malpractice. And so we're always doing this. We practice medicine. We know what CYA is. We know what CYA medicine is and what CYA documentation is. You're writing a letter to your future self with the intention that you might be sitting on a courtroom and you're trying to remember something that happened years ago. And so there's always these fears. And the thing is that when we're doing our best, things happen to patients and there's nothing that we can do about it. And bad outcomes happen despite all your best efforts. This is what medicine is. But with all these other fears and baggage that we're bringing, there's so much. And what happens is a lot of times when maybe our home life is not so great, maybe there's a divorce, maybe there's children that are having difficulties growing up and there's more needs and more time needed to be with them, except that we don't have the schedule that will accommodate that. And we're trying to put people in places to basically replicate us, nannies, babysitters, all these other things. And this is really affecting. Something happens in our core layer and then the house of cards comes down. And the problem is that for us, physician suicide is a real deal. We've had 3 surgeons in this last year in Denver who have died by suicide. And this can't keep happening. We have to do something and we have to help one another and we have to live one another. Really, we have to really help each other live safely and comfortably and feel valued and feel worthy. Anxiety, depression, all of these things are part of our experience with medicine. We're dealing it with our patients, dealing with it in our home life, and we are dealing with it in our own hearts. And so we have to make sure that we're dealing in a way that is kind and compassionate. We need to treat ourselves with loving kindness because that's just not happening and no one else is coming for us. We have to really realize this. We have to build an inner circle that we can rely on and we can show up for them as well. But no one is coming for us. The public are not coming to save us. Insurance companies are not coming to save us. The hospitals are not coming to save us. All of these people are working us to death and they are okay with the status quo. And this is not going to work for us. So we have to be better. We have to do better. And the most important thing is we have to develop some sort of self-worth. And the message that we get from all of these people is that nobody cares about us. If we die, the next one is stepping into our place and it's on to the next one. The insurance companies don't care. The patients are going to see other physicians, nurses, anyone else. If we're gone, the next one is right there. If we're not there in the hospital, they're going to hire somebody else. Doesn't matter. None of these things are mattering. So we have to take it upon ourselves. It's no one else's job but our own to make sure that we are taking care of the best way that we can, because only we know exactly what we need. And it's time for us to really start having these conversations about what we want, what we need, and what is non-negotiable anymore. The next is our spiritual being. And this really covers so many different things. This could be religion and how we pray, meditate, however we communicate with whatever higher power that we may or may not value. And the other thing is that we have to be spiritual in the way of really getting into our own self. And this is where I think meditation is really, really key for us. And it doesn't matter about what religion you are, really getting into a very quiet mindset of who am I, where am I, and what's going on, and deep breathing. The problem that we're having is that the cortisol levels that we run at, it's not sustainable. And we have to get inside our own beings and we've got to bring those cortisol levels down. And so doing meditation and connecting with other people and really finding a core value that resonates with us, and we can go with other people that we care about and we can share those values. And ultimately, the thing is, I feel like we're the leaders in this as well, because every day we show up for anybody, for it doesn't matter who they are. There's no politics. There's no crimes. You know, can just treat everyone 100%. That's how we show up in medicine. That's how we have to show up with one another. And we've got to treat each other as kind and loving as possible. And we need to start treating ourselves at the level that we're treating our patients. Now, the next thing is our sensory being. And this really, it's very, very intuitive. And, we know the five senses, right? We can smell and hear and see and taste and touch. And so that's a five sensory being. And if you know anyone who's read Seed of the Soul and Gary Zukav, they know some more about the multisensory being. But we are multisensory beings because we're using all of those senses that we have, but we're going deeper and we're going inside our heart and inside our gut, because many times we have short periods of time that we are with our patients and we don't have any time. We've got to get to the answer right away because that patient's going to run out of time. And so we've got to get to that. And there is an internal feeling that we just know. And so we have to be connected to that, because there's many situations where we're working on little to no information and we have to go based on our experience. We have to go based on our knowledge and based on the entire thing that we're seeing, we've got to be able to condense that down and move forward with a plan that is workable. And that needs to extend beyond just work, but also, when you're a parent and you're dealing with your kiddo and you don't always have all the answers of what's going on, you need to go deep inside and use that experience and that intuition and really come forward with that. We need to be connected with that. And when we get into self-doubt, then that's a problem because that's a key part of how we are using all of our resources to deliver the best care for our patients. Now, once we get ourselves taken care of, right, these are our beings and these are the things that help us be the best who we can be. But what happens? Okay, now Lisa is as best as she can be, but what happens when I get with other people? And so this is our relational being. And this is really key because how do I show up as a mother? How do I show up as a wife? How do I show up as a daughter? How do I show up with my patients? How do I show up with my friends? How do I show up with my community? I love race car driving. And so how do I show up with all of my friends in the racing community? I'm a diver, so how do I show up in my diving community? So these are all the communities that we're a part of. And we're not showing up as, I'm Lisa the plastic surgeon, and so I'm showing up on the dive boat as the plastic surgeon. I'm showing up as Lisa the diver. But really, I'm Lisa the girl who loves diving. And while I may have a role potentially as a dive master, I'm still the girl who is showing up with the love of diving and the love of people. And how am I going to connect and communicate with these people? And how is that happening? And how are they going to communicate to me? Do they feel safe? Do I make them feel safe? And these are all the things. And I feel like in medicine, many times we don't feel safe. We don't feel safe as practitioners. And of course, the patients don't feel safe because they're sick. And so we have these dueling areas of fear, and we have to come out of those places. And how we relate to people, I think, is a great place where we can start to begin to develop safe relationships and provide a safe venue for someone to come and be present with us, because that's what patients are doing. But we also need that to have a good relationship with our close families. Now, the other thing is the community that we are part of, that we have the least connection to, is our own here in the healthcare community. And one of the problems is that we're so busy and we're going, and we have been trained from communication standpoints and charting to be as brief and concise as possible. But we really need to show up for one another and all of the people. So when I go to the OR, it's not just me showing up. There are so many people that have to make that happen. And so from the check-in person at the hospital to the preoperative staff, to the OR staff, to the recovery staff, all the people that get all of the equipment to us, all the supplies to us, all of the people who prepare the ORs, there's so many people, and I can't do my job without any of them. But the way that we are talking to one another, it's brutal, and we have to support one another. And here's the thing, we as a collective are a huge community, and we can do better, and we have an incredible negotiating power if we all look up. And one of the problems is that we're slaying dragons all day long, and we got our heads down, and we're going forward. And we don't even know that, there's no more dragons because we have our head down so much. You finished your day, but you're still in that place of fighting. And that comes out in our relationships with our families, with our friends, but especially with our patients. And so we have to take care of one another. And if the nurses have a problem, then all the rest of us have to come together and stand behind them and say, no, the nurses need to be taken care of in whatever issue that they're doing. physicians, we need to come together, and it's not like, well, I'm a surgeon and you're OB-GYN or your family practice or your radiology or your pathology. No, we are all one another. And here's the thing, our bodies are being broken in surgery. If you look at the surgeons long term, ask a surgeon, how's your neck? How's your hands? How's your back? There's multiple issues that are related to long term treatment of this. And I was on a thread on Doximity not too long ago, and someone had brought about trying to discuss, okay, we need to start doing something ergonomically, or we need to come up with some plans, whether it's physical therapy, seeing doctors for our own selves, changing the OR, like starting the conversation. And this person put it out, and there was a litany of people who were just saying, I've got this, I've got this, I've got this. And I am one of those people. I've already had neck surgery. I have issues with my thumbs. I've got hip and back issues. That's me. But so everyone's writing that. And then there was a surgeon who got on there and said, stop whining. You're not a manual laborer. And this is the kind of issues that we're facing, this infighting of just stop. Like, it's, if our kid came to us and said, mommy or daddy, I have a broken hand, we wouldn't tell them, stop whining, right? We're going to take care of them. We need to take care of one another the way we're taking care of our patients, and we need to take care of ourselves that same way. And we need to look at our community as brothers and sisters, and we've got to come together, because insurance is not getting better, and they are not out to help us. The hospitals are not necessarily out to help us. The hospitals are in a similar situation because they're trying to deal with insurance companies as well. But they have a different focus, and our focus is patient care. But our number one focus above all needs to be our own care. And we've got to take care of one another, and we have to lift one another up, not claw and drag people down, because that is what is happening very frequently in medicine. And when you get a call in the middle of the night and you've been up all night, and there's somebody who's just sending you a text and they don't know what they're talking about, and you pick up the phone and you ream them, that's a teaching opportunity. But you can't even show up for that because you've been up for 22 hours. So these are all the things that are all in play, and we've got to do better, because there is something much better on the other side. We just can't ring out or die out before getting to it. The last is our intentional being. And really, this is much more deep in our core. Why did you go into medicine in the first place? What were you hoping to get out of it? What else is there for you? What wakes you up in the morning and you are so excited to get up and go do? What are these intentions? Is it serving people? And in what way? And what does that really mean to you? And these are the things that, we started off way, way, way back when we decided, I think that medicine is really what I want to do. But there's a process, right? So you don't just decide that and then go do it. You have to go be trained. And in that training process, the love of serving people and the love of helping people gets twisted, and it gets trained. And so we're going to help them in ways we never imagined. And that's a good thing. But it also is a bad thing, because now maybe we are destroying our own selves in this process. And long term, that's not going to serve us. And so what is really in your core? What makes you happy? What lights you up? And so these are the things that we have to get back to, because we're not going to be in medicine necessarily our whole lives. This may be a period of time, but ultimately, even if this is our love and we do well in it and we thrive in it, at some point we're going to retire. And then what happens after that? Who are we? And we are not doctors and nurses. We're human beings. We are not physical therapists. All those things will gently fade away as we age. And we have to think about, where we're going. And is the path that we're on leading us to the path that we're trying to get to? I think that the closing thing that I want to leave you with is this is something that's very near and dear to me. And the deepest embrace you will ever have is the complete embrace of your own humanity, exactly as it is. It's not what they've made us to be, but it's who we really are in our authentic self. And so I'd like to leave that with you. And I wish you well. I wish you loving kindness, and I wish you a wonderful journey of rediscovering who you are. We'll spend the next several podcasts diving into each of these and being much more specific about them, but I hope this has helped you. Please feel free to share this with all of your healthcare colleagues, because they need to know, if nothing else, I'm here for them, and the Soulful Surgeon Podcast is here to hear them. And I would like to hear your stories. I would like to hear anything that you're struggling with. So please feel free to reach out to us so that we can bring all of these issues into one of these 7 remedies, because basically we're dealing with all of those. So thank you so much, and have a great rest of your day. Thank you for joining me on the Soulful Surgeon Podcast. I hope today's conversation offered you reflection, encouragement, and a reminder that you are not alone on this journey. If this episode spoke to your heart, please share it with someone who might need it as well. And don't forget to subscribe so you never miss a moment of connecting with healthcare workers all over. You can find us on the web at soulfulsurgeon.com. You can find us on Instagram at Soulful Surgeon. And you can find us on LinkedIn at Lisa Hunsicker, MD. Until next time, take care of yourself the way you care for others. And remember, your story matters here.